what are some common fertility tests which are recommended for the male and the female partner? As far as fertility tests are concerned, which are specific for the female partner, they focus on three main things. The first is going to be ovarian reserve, the second is going to be ovulatory function, and the third is going to be the presence of any structural abnormalities in the reproductive organs. When we say ovarian reserve, we are looking at the number of eggs which are present in the ovaries. As women age, the number of eggs in the ovaries start falling down, and the rate at which this descent happens is not something which we can control. There are certain women who start having a fall in their reserve from the age of 35, and there are also certain women who might have fall a little bit more accelerated, and they might start losing their ovarian reserve as early as 30 years of age. Evaluated by two means. One is to do a blood test where we evaluate a hormone which is called as anti-Mullerian hormone, or AMH. Now this hormone can be checked at any time of the menstrual cycle, and this gives us an idea as to what is the number of eggs which are remaining in the women's ovaries. Now this is as so far true only with the oocyte quantity and not the oocyte quality. The second modality wherein we can actually identify the ovarian reserve is to do an ultrasound wherein we can check the number of follicles of a particular size which are remaining in the ovaries, and this will give us an idea whether the AMH and the AFC put together can help us reach a fertility plan. The second aspect which we check in a woman is going to be the ovulatory function. We all know during the menstrual cycle the egg is released at a specific time during the menstrual cycle, and usually for women who have regular cycles this is around the 14th day of our menstrual cycle. Now whenever there are any kind of medical disorders or hormonal dysfunction which can interfere with this release of this egg, it can interfere with normal fertility. In conditions like thyroid dysfunction, or in patients where they have elevated prolactin levels, sometimes ovulation is affected, and therefore the chances of conceiving in that cycle may be either be delayed or it can be denied. So it is necessary for us to understand how these hormones are by doing a basic blood screening where we check the TSH and the prolactin levels of women. This is preferably done on the second day of the menstrual cycle. Apart from this, we also do an ultrasound on the initial visit wherein we can screen the reproductive organs for presence of any kind of pelvic pathology. Now this can be either an ovarian cyst, or it can be a fibroid in the uterus, or it can be a polyp inside the uterine cavity. All these pathologies have been found to interfere with the process of fertilization, or it can also interfere with the formation of the egg, or it can interfere with the implantation of the embryo. If any one of these stages of the embryo development or its implantation is affected, definitely the women can have a problem in conceiving the natural way. Therefore, it is necessary for us to identify the ovarian reserve, evaluate the ovulatory function, and also look at the structural abnormalities which can contribute to infertility. Some of the tests which are recommended for the male partner include a blood screen for basic metabolic function like a fasting sugar, a thyroid hormone level, a prolactin level. Similar to a female, males also have these hormone functions affecting sperm production. One of the most important tests which we order for the male partner is the semen analysis.